With India set to begin vaccination of children in the 15-18 age group from January 3rd against coronavirus, Dr. Gagandeep Kang, a leading virologist, has said this. I believe we should be sending children to school as generally COVID-19 infections are not much severe in children. It is classes and the learning that they get in classrooms or the interactions of their peers that offer them so much more benefit than the small risk of infection if they go to school, Dr. Kang told ANI in an interview. In children, fortunately, infections with SARS-CoV-2 are generally not severe. There is a risk of long COVID. There is a risk of a very, very rare condition called MISC, that is Multisystem Inflammatory Syndrome. But by and large, healthy children have nothing, she added. Prime Minister Narendra Modi had announced vaccination for children in the 15-18 age group on December 25th. The step will aid in education normalization in schools and reduce the worry of the parents with school-going children. He also announced precaution dose for frontline workers, healthcare workers and senior citizens with comorbidities from January 10th. Answering a query, Dr. Kang said there is very little data available as to which vaccine should be used as a booster dose in India. India's new COVID-19 cases had declined to around 6,000, but the number has been rising over the past few days. India has reported about 1,270 cases of Omicron variant, which was first reported in South Africa. Fortunately for us, Omicron seems to be somewhat less severe than other variants we have seen, and this may be because our population has had high levels of exposure or has been vaccinated very highly, as has been seen quite clear from South Africa. So Omicron, we hope, will not be as much of a concern as our first experience with the Delta variant, she said. I think it's very clear that we are going to have to learn to live with SARS-CoV-2 virus and with the various variants that will continue to emerge from a virus that replicates at a very high level, she said. Dr. Kang said it is vital to monitor the severity of the disease due to the new variant, and the situation will not be like that in the first and second waves of COVID-19. News Desk, Kaumudy Global.